Now, a new global study has confirmed that polycystic ovary syndrome, or PCOS, affects nearly 1 in 10 women of reproductive age worldwide. The 2024 analysis found a prevalence rate of 9.2%. Polycystic ovary syndrome is a common hormonal disorder in women of reproductive age, characterized by symptoms like irregular periods, excess hair growth, acne, and infertility. It results from a hormonal imbalance, specifically high levels of androgens, and can lead to polycystic ovaries. However, experts say diagnosis rates vary widely, from just over 2% to as high as 26%, depending on location and diagnostic methods. For example, a recent study in India found a rate of over 17% among young women. PCOS affects an estimated 70 million women globally. Researchers say more awareness is needed for the condition, whose exact cause remains unknown. We now turn to an expert for more in-depth analysis about the PCOS as the world continues the commemoration of the Polycystic Ovary Syndrome Awareness Month this September. Dr. Abayomi Ajayi, a fertility physician, joins us now on Newsday. Thank you for joining us. Good afternoon.
Good afternoon. It's my pleasure.
This is really a very worrisome situation. Over 70 million women worldwide suffer from PCOS. Tell us what PCOS is and the significance of this PCOS Awareness Month.
Thank you so much. I think to lay the background, let's say one of the biggest problems is that about 70% of the women who have PCOS remain undiagnosed worldwide. So it's not a Nigerian problem. Now,
so it means even the 70 million is really not.
It's an understatement. It's gross understatement. Now, what is polycystic ovary or polycystic ovarian syndrome? Well, this confusion came from when we started to make the diagnosis. In 1935, two gentlemen reported this. It was Tain and Leventhal, who first pointed us out that there might be something going on with women. But we thought it was only a reproductive issue. But over time, now we know that this is like a systemic issue. You might first notice it in the reproductive system, where you see maybe polycystic ovaries on scan sometimes, which is the commonest way that people make the diagnosis in Nigeria. But because of the confusion all around, in 2003, a committee sat down together and said, look, how do we diagnose this condition? Because that was the problem, the diagnosis. So they agreed that you must have 2 out of 3 things for you to be able to diagnose PCOS. The first thing is that there must be irregular or absent menses. The second thing is that, like you said in your intro, there must be evidence of male hormones predominating in a woman, which we call hydrogenemia. Then this can be either clinical or through blood test, and clinical means you have male pattern hair distribution, either in your face, your chest, your abdomen, or your back. Okay. And the third one is the appearance of this polycystic ovaries, which we usually describe as a string of pearls. That's what it appears like in the outer covering of the uterus. So this was what we were doing until then. 20 years after, 2023, there was still so much confusion. So they sat down again and said, look, let's look at how can we make this easier. And so they said, look, sometimes because the scan finding might be confusing, because for you actually to make the diagnosis, people just look at the pearly appearance. But if you see a young girl, normal young girl, you can see that pearly appearance normally because she has many follicles in her ovaries. So what was added then was that the volume of the ovaries must be more than 10 cm, but very few people can do ovarian volume. So they made it easier in 2023 and say you could replace that scan finding with a blood test, which we call AMH, anti-malarial hormone, which we do commonly to assess ovarian function in infertility. So now from 2023, we now you can say, okay, fine, even if you don't have a scanner, you can still diagnose PCOS by doing a blood test for AMH. If it's elevated, and then you have this woman is not having regular periods, or she doesn't even have periods, or she now has this male hormone appearance, either which I described, could be hair in abnormal places or even baldness and acne, just like you reported in your intro. Does that make sense? Good.
All right, Dr. Abayomi, I read it somewhere that the exact cause remains unknown regarding, and you've already mentioned about the symptoms as it were. What are the treatment options, and can it actually be cured? Okay, you have several symptoms showing up with all these diagnoses, but what's the deal here?
Yeah, the thing is that it's like that's the way you're wired. Okay, so we're not talking of a cure. We're talking of a management. How can you live with this throughout your life? Now, for us to be able to see that, we need to know what are the implications when there is no diagnosis. Okay, and that's why I said it's not a reproductive issue anymore. It's a systemic issue because it affects almost every aspect of your body. So you can have the easy ones that we know are the reproductive ones, which is that you might have irregular cycles, you might have infertility. 85 to 90% of them have irregular cycles. 70% of them have infertility. Okay, now you could also, when you get pregnant, okay, you could develop pregnancy-induced hypertension, you could develop pregnancy-induced diabetes. Okay, now also in the metabolic scene, you can also, you could have insulin resistance, which will predispose you to having type 2 diabetes. Okay, then you could also be obese, all right? Usually truncal obesity, which is a dangerous form of obesity, predisposes you to heart diseases and so on. Your respiratory system can be affected. So you have what we call sleep apnea, you know? And then, of course, even the liver can be affected. And so you can have fatty changes in your liver, which can lead to cirrhosis or hepatic cancer later on in life. Can. I'm not saying will. And also the gynecological cancers like endometrial cancer also are also possibilities. So it's so important to make a diagnosis so that you can stop all these things from developing. So now, but when you talk about the treatment, now it depends on what you are treating. Is it the reproductive thing? But whatever you want to treat, the first thing is lifestyle. There must be lifestyle changes because we've seen that some of the risk factors involve lifestyle issues. Okay, and especially with what we eat. We're seeing a lot of prepubertal obesity, kids getting very fat. That's a risk factor for polycystic ovarian syndrome. Okay, like I said, truncal obesity is also a risk factor. So sedentary lifestyle is a risk factor. So these are modifiable risk factors, apart from the ones that are non-modifiable, like your family history. You don't have control over that. That's non-modifiable. Your ethnicity also, because we've seen that in some ethnic groups it's more common. We cannot talk of Nigeria because we still don't have data in Nigeria, but it seems as even in Nigeria, it might be more in some ethnic groups than the others. So it depends on what you are treating. For the fertility bit, which is probably the one that is more spoken about, it's not, if you ask me, it's not really a terrible thing to treat if what you are talking about is fertility. But we know it goes beyond fertility. So it's not because you have had a baby, you have polycystic ovarian syndrome, you've had a baby, that's the end of it. Nope. Because you have to manage it throughout your lifetime.
You know, some of these symptoms you've mentioned sound like the telltale signs of some other medical conditions. So how do we tell for sure that this is, a sign or a symptom of PCOS? And also, there are some myths and misconceptions when it comes to PCOS. Can you help us break those down?
Yeah, the thing is that you must be talking to somebody who knows what he's talking about to start with. And I think Nigerian healthcare is becoming more sophisticated, especially in Lagos area, if you ask me. Sometimes it's the opposite way of sophistication, but it's still okay. The consumer know more. Dr. Google is very helpful. Sometimes it does over syllabus. Sometimes it's okay, but people are more aware. So it's easier in this part of the country, if you say. But of course, there are some parts of the country where it's not this evenly distributed. So we cannot but continue to do this kind of program where we let people understand what's happening, what they might. And the fact, like you said, that it could mimic some other things, yes, it could. And that, but if you follow it very well, that if you say 2 out of 3 of this must be present, yeah, then it's likely that you're making the diagnosis. But the problem most of the time is that people only look at it from the reproductive end alone. They don't know that it's something that you have to live with throughout your life. And even when you have had your babies, for example, if you, let's say you are even reached the age of menopause and you have abnormal bleeding, if you have polycystic ovarian syndrome, you are not somebody who should just lay low and say, no, it's not, nothing. Because there's a risk of endometrial cancer. So there is no screening test that you should do, but complaints, symptoms should not be taken lightly. And you should immediately start thinking of seeing the doctor who should take an endometrial biopsy and be sure. Because most of these things, any disease, early diagnosis is probably the best thing that you can, if there is no screening for it. But if there is screening, of course, then you can do the screening. But if there is no screening, early diagnosis is usually the best thing. And that is one thing that we don't do so much in Nigeria. People, most of the time, work until they break down. So, and then even when they have symptoms, they want to wish it away until it becomes really advanced, or if you like.
All right, Dr. Ajayi. Now, researchers are emphasizing on PCOS awareness. So what's the scenario like for PCOS month here in Nigeria, you think? Have we been consistent with it, or is just something we just mention every now and then?
Yeah, we are trying to be. There's so many things to talk about in Nigeria. So we're trying to be, okay? And that's why we're doing this, for example. We're trying to be, to let people be more conscious of it. And also, even for the physicians, you know, because you see some people even still say, like, some of the myths that once you've had a baby, it's okay, it's all over. It's not, you know. So we need to let people understand some of these things, and then that's where the awareness month is so important.
But beyond the awareness, what comes next?
Well, beyond the awareness, can there be too much awareness? We just have to continue to talk about this. And we just have also to, you know, now the Nigerian American Dental Council is trying to put that doctors also should do continuous professional development, because these are also part of these things that will make people to put these kind of things in the forefront.
And I'm hoping that this awareness goes beyond the elite, that we break it down to local languages so that those in the rural communities can also understand what this means. And also, I'm also looking at how affordable is treatment for PCOS.
No, it depends on what we're treating, you know. If it's infertility, for example, and it's just that you're not menstruating because you're not ovulating, that's probably not difficult. Okay, but if it's complicated by other things, for example, you now also have your man also has bas sperm parameters, then that becomes, maybe you are going to be looking at IVF. In that case, that might be a little bit more pricey. So it depends on what, the first thing is just for you to know that this is not normal and presenting to the doctor. I think the price tag comes later after that.
When it comes to prevalence in Nigeria and your experience in treating such symptoms, what has it been like? Is it a frequent occurrence, or it's just one of those run-of-the-mill scenarios?
It's common. It's common. And there have been papers even released in Nigeria from different parts of the country that have shown that as much as about 18% of the people who present in some centers, to 12% in some centers, to, I think the lowest is about 8% in some centers. So it's really prevalent.
And that's despite the fact that we don't even do enough testing.
But don't forget again that sometimes, you know, why it's difficult to quote some of these figures, that they're not community-based figures. They are figures of patients who present in hospital. Before you present in hospital, there's already a problem. So it's difficult for us to beat our chest and say this is the prevalence in the society. It's a skewed population that we're seeing.
Very good. Hopefully we'll continue to get the word out there, you know, on this polycystic ovary syndrome, or PCOS, which is a health problem, apparently. Dr. Abayomi Ajayi, a fertility physician, would like to thank you for your thoughts on those issues. Good to have you as always.